All right, starting now. Hey, good afternoon, NCRGEA members, and welcome to today's webinar, Getting Ready for Aetna in 2025. This is the third in a series of NCRGEA Lunch and Learn monthly webinars, and I'm your host, Tom McCullum. Today, I'll be joined by Tim O'Connell. He's the NCRGEA's Executive Director, who will provide you with an update on the association's activities. Also today, we have Beth Horner, the State Health Plan's Director of Customer Experience and Communications, and Hannah Bowen, Senior Manager of Account Management for Aetna's State Health Plan team. Before we begin to our YouTube account, we're going to post it later, and links to that posting will be sent to you as well as posted on our webpage and social media sites. Each of you has been muted to help ensure the presenters can be heard. If you have a question, please use the chat icon at the bottom of the page. Yes, you can write a question and send it to us. We'll try to respond to you through chat during the webinar, but if not, we'll read most of the questions at the end so Tim, Beth, or Hannah can answer them. However, if there are any specific ones that cannot be answered, we will ensure you receive follow-up communication that addresses those responses. We'll also be posting questions through our poll feature during the conference that you can answer. We do this to help emphasize important points and to add focus to what we're saying. Lastly, we'll be sending you each a survey about today's webinar. The intent of the survey is to get your feedback so we know we're meeting your needs and expectations. The survey is quick and easy to complete. Please just get it back to us by Monday. So without further ado, here's Tim O'Connell, the NCRGEA's Executive Director. Tim?
All right, thanks, Tom. Appreciate it. Hey, first, I just want to say good afternoon, and it's great to have you all here. We appreciate you as members, and we appreciate the work you did as public service employees when you worked in your careers. You made a difference, so I want you to know that. I want to also quickly thank Beth from the State Health Plan here. She's going to get some time, but the work we do, honestly, we could not do it without the collaboration of the State Health Plan. So really appreciate it to the Treasurer's Department and the folks at the State Health Plan. Also great to have Hannah here. I got to know her a little bit at our spring conference up in Hendersonville, and it was just excited about the possibilities in the future working with Aetna here, and especially with Hannah. A couple of things that I think you're going to be interested in. First, on the association, just know that NCRGEA is having a fantastic year. Last year, nearly 4,500 new members joined. We continue to be the state's largest organization of public service retirees and the nation's largest. Not
concerns that you have regarding this announcement. First and foremost, I just kind of wanted to do just a quick housekeeping thing, which is really just define what a third-party administrator is. It's a very fancy formal title. And we often just tag it with TPA because it's just easier to say instead of all the big words. But a TPA is someone who administers the benefits of our plan, our 70-30 plan and our 80-20 plan. And they process claims and they provide a network of providers for our members. The State Health Plan has a board of trustees, and they are the ones that set benefits and premiums. So the TPA, which is currently Blue Cross and Blue Shield of North Carolina and has been for very many years, they do not set premiums. They do not change benefits, copays, deductibles. That is all driven by the State Health Plan's board of trustees. So a TPA is an extension of us who acts on our behalf to process the claims that you submit to your provider and provides that network of providers. One of the things that I do want to point out is this particular change, again, does not impact our retirees, our Medicare retirees on the Humana Group Medicare Advantage plans. This does no way impact the Humana Group Medicare Advantage plans. So if you were on those plans, this is not really applicable to you. It does not change anything for you. So this is applicable to our retirees who are not yet Medicare eligible, who are on the 70-30 and the 80-20 plans, and the Medicare retirees that we have on the 70-30 plan, which is for just reference, just a very small population of our Medicare retirees. So with that, I wanted to make sure that everyone was aware that nothing is changing for the 70/30 and the 80/20 plan in regards to your pharmacy benefits. Some people had questions about that. We have a pharmacy benefit manager that does the same type of thing on the pharmacy side as the TPA does on the medical side, which is CVS Caremark. Nothing is changing with that. They are going to continue to be our pharmacy benefit manager. So again, copays, deductibles, plan offerings, so the 70/30 plan and the 80/20 plan, it is all saying the same for 1/1/25. We will not be making any changes. We have been working with Aetna since January regarding this change, and we are going to do our very best to make it as seamless as possible for our members. So we are not going to be changing any benefits for 1/1/25. A lot of people are asking, so what changed? Why did you change? You've been with Blue Cross forever. So what a lot of people don't realize is the state health plan is able to go through what is called a competitive bid process for large contracts such as this. We've done it for years. We do it on any large dollar amount contract that we have that administers any type of benefit or service to our members. We conducted a competitive bid process, and through that process, Aetna won the bid, and the state health plan and the treasurer announced that change in January of 2023. So again, it is a kind of a state procurement process of a competitive bid process that led to the award of the contract to Aetna. One of the other questions that we always get is, of course, the time frame. So I appreciate that you all are still on the ball and want to learn all the things, but we still have an open enrollment to go through this fall for 1/1/24. So again, nothing is going to be changing for 1/1/24. Blue Cross will still be our TPA for 2024. Open enrollment, just a little plug for you all, is October 9th through the 27th of this year. So if you do want to make a change of any kind, you do need to do that during open enrollment. For our Medicare retirees, if you're happy on the plan that you are on currently, you don't have to take any action during open enrollment. You only need to take action if you want to make a change or add any dependents. Also, you will not be getting a new ID card for 1/1/24 unless you make a change or add dependents. So I did want to just make sure that everybody knew that this particular change is not until 1/1/25. What I do want to do is make sure that everybody understands that keeping your contact information up to date in Orbit and in the plans enrollment system, which is called eBenefits, is critically important so we can make sure that we are getting information to you. Starting early next year, we are going to start communicating this transition and making sure that everybody is up to speed on all things related to 1/1/25. The goal that we have and the goal that Aetna has and how we're partnering together is a seamless transition. You will know a difference because you will be getting an Aetna ID card toward the end of 2024. So again, no changes for 1/1/25 in terms of benefits. So there was lots of questions about referrals and prior authorizations and how all of those things are going to be impacted. And again, I'm going to use something that the treasurer has used quite often, and that is his terminology about a transmission. And I'm not a car girl, but I get this analogy and how it works. We are changing transmissions, so everything is supposed to work the same. We're just changing out the transmission. So we really do want members to understand that we're trying to make it as seamless as possible, which is why we are not doing any major benefit changes for that 1/1/25 for that very reason. So just in summary, and just to kind of wrap up my part of this is, again, it does not impact anybody who is on the Humana Group Medicare Advantage plans. We are not going to have any benefit changes for 1/1/25. We are going to start communicating this to you all next year, so make sure your contact information is up to date. We are always a happy partner for your fall and spring district meetings, so we will definitely partner with you all there, as well as Aetna, so you guys can ask questions and get involved that way. But that is all I have for you today. I hope that cleared up a lot of your questions. Feel free to drop us a chat if you have any more that I did not address, and I'm more than happy to try. And if I cannot answer your question, we'll definitely get that answered for you by next week.
Okay.
I'll hand it back over to you.
Thanks, Beth. That was a lot of important and useful information for why the state has selected Aetna as its third-party administrator, and we hope it's been a benefit to you all. If you didn't get any other message, and Beth, correct me if I'm wrong on this, but right now, this change will not affect your plans through the state health plan.
Correct.
All right, I want to introduce Hannah Bowen. She's the senior manager of the account management team for the Aetna State Health Plan team. Hannah?
Yeah, good afternoon. Welcome, everybody. It is a pleasure to speak to you all today. I know Beth has already answered many questions, but we'd like to show a brief presentation that answers some of the most frequently asked questions that we receive here on the Aetna side regarding the transition that will take place on 1/1/25. We understand that change is scary, but I think these questions and answers will reassure you and alleviate your concerns. So, Patty, yeah.
This the legal disclaimer is up at this time.
Yeah. All right, I think that's actually at the end. If you want to go over to the left-hand side and click, scroll up and click on the first one.
Thank you.
Yeah.
Today we will be reviewing frequently asked questions regarding the North Carolina State Health Plan's transition to Aetna as their third-party administrator.
So who is impacted by this
Effective
change?
January 1st, 2025, if you are on the base PPO plan 70/30, enhanced PPO plan 80/20, or high deductible health plan, your new third-party administrator, or TPA, will be Aetna. Members on the Humana Medicare Advantage plans are not impacted by this change.
So what is a third-party administrator?
A third-party administrator, or TPA, is an entity that receives and processes claims on behalf of another organization. Aetna will manage the operations of the state health plan. This includes claims processing, healthcare provider contracts, customer service, and more. However, all decisions about premiums, copays, and benefits will still be made by the State Health Plan Board of Trustees, not Aetna. For more information, visit the North Carolina State Health Plan website at shpnc.org.
What services does a TPA provide?
The third-party administrator works to ensure the state health plan operationally runs smoothly and affordably while responding to the needs of members. The third-party administrator also decides which healthcare providers, i.e. doctors, specialists, hospitals, etc., are in-network, provides disease and care management services, ensures superior customer service for plan members, and much more.
How will the transition to Aetna impact my health insurance costs?
All decisions about copays, premiums, and benefits will still be made by the State Health Plan Board of Trustees, not Aetna. Our commitment is to deliver affordable and high-quality health benefits to those who teach, protect, and serve the great state of North Carolina. Funding for state health plan members' medical claims comes from member premiums and from taxpayer dollars appropriated by the North Carolina General Assembly.
Are there pre-existing conditions that won't be covered?
All pre-existing conditions are covered under the state health plan.
How does Aetna's network compare to the current state health plan network?
As part of the application process, Aetna provided data to analyze the millions of state health plan claims submitted over an entire year and compared those claims to Aetna's current network. The result? 98% of claims were paid to a healthcare provider that's in Aetna's current healthcare network. Even with that very high match rate, Aetna had already begun communicating with additional doctors and specialists to add them to the network before the January 1st, 2025 transition.
Are all North Carolina general hospitals, also known as acute care hospitals, in Aetna's
Yes.
network?
All of these hospitals are in network with Aetna.
And what commitments can Aetna make if a doctor or specialist isn't currently in the network?
If your current doctor or specialist is in network for you right now, but is not in Aetna's network, we will contact them to begin the process of adding them. If your doctor or specialist is not in Aetna's healthcare network, they can request to join.
Will I get a new ID card?
Prior to Aetna becoming the new third-party administrator for the state health plan on January 1st, 2025, all members of the state health plan will receive new ID cards. They'll also receive all the information they need to understand their benefits.
Will there be a change in the type of health insurance plans offered by the state health plan?
There will be no change to the benefit plans currently offered by the state health plan. The State Health Plan Board of Trustees will continue to make decisions regarding the benefit plans. Thank you for joining us to review frequently asked questions about the North Carolina State Health Plan's transition to Aetna as their third-party administrator.
All right, I'll turn it back over to Tom.
Okay, and with that, right now, folks, we'd like to get into the questions and answers that you've all asked. Most of your questions should have been answered already. And as we go through the questions, we'll try and skip those. But again, however, if there are any questions that we cannot be answered today, we'll ensure you receive a follow-up communication that addresses your responses. So I'm going to go first on the questions that were submitted during the webinar. And Rachel asked, how will new insurances affect retired members? Beth, I believe that one is yours.
Was the question how other insurance is impacted?
Or how will the new insurance affect retired members? Now, basically, this is not new insurance, correct? This is strictly Aetna taking over the administrative portion.
Yes, this is not going to impact your coverage. So like we said, you're still going to have the 80/20 and the 70/30 plan offerings. Humana is still going to offer Medicare Advantage plans, which is not impacted by this change. No copays, deductibles, or co-insurances are changing for 1/1/25. So there should be very minimal impact to members for this change because again, it's not changing your options.
Okay, now will this affect any members that are about to sign up for Medicare?
No. Okay. Well, I mean, if you choose to be on the 70/30 plan, yes, you will notice you will not have a Blue Cross card. You'll have an Aetna ID card at the end of next year, but it doesn't impact any processes of you applying for Medicare, getting on Medicare. You're still going to have the same plan options when you become Medicare eligible.
So the 70/30 Medicare folks will continue to receive coverage from Humana?
No. Humana administers the Medicare Advantage plans. So we have a base plan and an enhanced plan. The Aetna transition impacts only people who are going to be enrolled in the 70/30 plan and the 80/20 plan. If you're Medicare eligible, you have three choices with the state health plan. You have two Medicare Advantage plans or you have the 70/30 plan. The 70/30 plan is what is impacted by this transition to Aetna.
Okay. And this will have nothing to do with anyone, say, who is in the military on TRICARE for life. Is that correct?
So again, if they're on the 70/30 plan and they also have TRICARE, it's still going to work the same way because again, it's just a different carrier, Blue Cross versus Aetna, but it's not going to work any different, if that's the question.
And then this is a different question, has not been asked. Will silver sneakers be part of any of the plans?
So Silver Sneakers is only offered with our Medicare Advantage plans, which is administered by Humana. And yes, we're going to keep offering that because that is through Humana.
Okay, as we get in now the questions that were submitted earlier. We already mentioned that if you have an existing ailment, issue such as cancer, that'll continue to be covered, correct?
That is correct.
Okay. This will not affect anyone's current vision, dental, or pharmacies, correct?
So again, pharmacy is administered through CVS Caremark. It's not changing your pharmacy benefits. The state health plan does not administer your dental and vision. So if that is something that you have through Pierce, that has nothing to do with the state health plan.
Will our, Donna asks, will our prices increase because of this change?
No. So again, copays, deductibles, co-insurance for 1/1/25 is staying the same.
So I'm going through all of these lists. I'm sorry, we have 154 questions that were submitted, and I'm trying not to redo repeats. I believe most of these questions were already answered.
Okay.
Though Laura does ask this question. It appears to her that why is there a constant 3-year changes in the plans?
So constant 3-year changes in.
And evidently every 3 years, she believes that every 3 years, the state health plan changes a large portion of it. Is that accurate, or can you address that?
Well, we haven't. So again, the Board of Trustees is the one who sets benefits, premiums. We have not had any copay changes or anything of that nature for 6 years. So in your open enrollment materials that you're going to receive this fall, I mean, we really do tout that as being something that to be proud of, that we've frozen premiums for 6 years in a row. We haven't raised copays, deductibles, or co-insurance either. I think what she's referencing is that, yes, the state health plan for our large service contracts, they are 3-year contracts and we have options to renew. And that is just industry standard that we do. We have to have a contract limit. And when that contract limit is up, we do a competitive bid process for all of our large major service contracts. And we can use the option to renew it for a year. So for example, this contract is a 3-year contract with 2 1-year renewals. And that is pretty industry standard for anybody that has such a plan that is large as us. So I think that answers your question.
If someone wants to change their beneficiaries, they don't have, this will not affect that process, correct?
No, because that is through the retirement system. So that has nothing to do with the state health plan.
Okay. And if, let's say someone is traveling and they go overseas, will the state health plan still cover them while they're overseas?
Yes.
Okay. Is there any direct effect to members other than receiving a new card that changing to Aetna will affect them?
So because there seems to be kind of a similar nature in questions. So again, the goal is a complete seamless transition. There are going to be some people who are in certain scenarios where you're in the middle of a treatment or a transition of care, and we are hoping to really hone in on all of those different scenarios and kind of walk those particular members through. But for the majority of members, it's going to be a change in your ID card. For a very small percentage of folks, there might be, like, for example, like a prior authorization. If you have a surgery on January 2nd, or, and I'm kind of giving you scenarios of just a very small population that might need some extra help or kind of help through the transition. And we're absolutely going to do that and make sure that everybody is taken care of and that it's as seamless as possible for everybody. So that I hope that kind of addresses the concern. For the majority of members, you're going to get a new ID card in December of 2024, start using it on 1/25, and there's no difference. You have the same plans, the same co-pays. And for a very small population that might have certain scenarios, we are going to very much be hand-holding those members to get them through that transition.
Okay, great. I just.
You ready me? Should I go ahead and launch the poll?
One moment.
Okay.
You can launch the poll, yes, please, but we'll still continue with questions. One of the questions is, basically, if you're covered, if you're being administered by Humana, let me back that up. This only affects people who are covered by Blue Cross or administered by Blue Cross and Blue Shield at this time, correct? This change?
Yes, so it only impacts people who are on the 70/30 plan and the 80/20 plan. And the current TPA for the state health plan is Blue Cross and Blue Shield of North Carolina. So 1/1/25, that will shift to Aetna. So you will get a new ID card in December of 2024 if you are on one of those plans.
Okay, and then will there be any changes in the network coverage?
So that's what Hannah mentioned, and we did some extensive analysis, and out of the claims data, no, there should not be any major impact to your network. One of the great things that we're going to be able to do next year, prior to open enrollment, is people are going to be able to check. And even the very small percentage of providers who were not in network with Aetna. Aetna pretty much started back in January, recruiting that small percentage of providers. So members are going to be able to know whether their providers are in or out of network, but there is a very small percentage that I'm pretty sure will be pretty minuscule in terms of member impact. So I hope that answers the question.
Now, and Kathy asked, will there be any changes to the programs in the various counties? But this is a statewide plan, correct?
It is a statewide, so the county, it's not related to the state health plan.
Folks, let me go over on recently asked questions one more time. I believe the question was asked, will it impact the Humana Medicare basic plans? And that was answered. We received names of providers. How will people know who the name of the providers in the networks?
So, I mean, you can simply ask your provider today if they take Aetna, but for next year, when the state health plan is able to provide information on our website, there will be a lookup tool, and members will be able to look up and see if their providers are going to continue to keep accepting it.
All right, and Rachel asked, when again is the open enrollment for this year?
So this year, open enrollment is October 9th through the 27th. And that is for benefits that start 1/1/24.
Okay. Folks, looking over a lot of the questions, from my point, most of them were asked during the presentation or answered during the presentation, or they were repeated from other people. If you have any questions, we still have a few minutes left. Please get them to me.
And your email is in the chat.
Excuse me?
I posted your email in the chat.
Okay, yeah, and if you do have, if you get later on, if you sit there and you realize that you do have a question, in the chat box is my email address. But if you're not comfortable opening the chat box, then my email address is very simple. And that's Tom, T-O-M, at ncrgea.com. I mean, it cannot get much more simpler than that. So if you have any questions, just kick it to me and I'll get it to Beth or Hannah and we'll get the answers for you. Beth, Hannah, do you have anything you would like to add?
No. Thank you for the opportunity to be here. I appreciate everybody's time. I hope it has been helpful and we look forward to working with you guys.
Yeah, it looks like it was. The poll showed that 94% thought that their questions were answered. Thank y'all.
Awesome. Great.
You have any questions? Tim, any points?
Nope. Thank you, Beth, and thank you, Hannah. Really good program, and I now know more. So I appreciate you sharing.
Good. That was the goal.
Okay, folks, that's it for our questions at this time. Again, if you have one, just kick one to me at tom@ncrgea.com. Don't forget to complete the survey we'll be sending to you later today. Again, it's quick and easy to complete, and we need them back by Monday. And one last point before
There
you
is a
leave.
link. There is a link, Tom, in the chat for folks if they want to click on the survey link now.
Perfect. And before we leave, we want to let you know about our next Lunch and Learn webinar in September. It will be held on September 6th from 12:30 to 1:30. And we'll be working with Lisa Williams with the Social Security Administration, and she'll be discussing upcoming changes in 2024 and what it'll basically mean for you if you are on Social Security or Medicare also. Again, thanks for joining us. And as always, the association stands ready to assist you in your retirement. Ladies and gentlemen, this concludes today's webinar. Thank you very much.
Thank you.
Everybody.